I'm doing some training through the ICPA, the International Chiropractic Pediatric Association. It's additional training beyond my chiropractic degree or my doctorate in chiropractic. So what it allows me to do is specialize in training that's specific to women and children. We use special assessment tools, special types of examinations, because when women are pregnant or when we are working with newborns, their bodies are obviously very different from that of an adult. So we want to make sure we're using techniques that are specific to their bodies and their needs. Babies don't have the same range of motion that adults have. They don't have the same muscle control. So we do a very gentle assessment, often held in mom or dad's arms, that really allows baby to be in their most comfortable position. We use very gentle techniques. I always tell new parents that the type of pressure that we use when we're adjusting a baby is about what you'd use to test a piece of fruit. So if you're testing a tomato, you'd use about that amount of firmness to help the baby's joints move into the proper position to allow for the best joint function. Not only is the birth process traumatic for mom's body, but it can also be really quite challenging for baby's body. That's a lot of force and trauma for baby to be pushed through the birth canal or even delivered via C-section. We see a lot of birth trauma that happens with that. And starting baby off on the right foot can do wonders. I always tell parents it's easier to stay healthy than to try to get healthy down the road. So getting babies checked right from birth is a great way to start. We use a lot of similar techniques to what we would use for a normal adult. However, we modify them to accommodate a pregnant woman's changing body. So we use special cushions and pillows depending on what stage of pregnancy they're at. We also use some specific assessment tools to make sure that we're helping the mom's pelvis and low back joints stay aligned to help have the most positive birth experience for them, really allowing for that good biomechanical function of the joints in the low back and pelvis to allow for an easier birth. I love working with kids because they respond to care so quickly. They don't have the same postural habits that adults have that can sometimes be more difficult to work through. Kids respond really quickly to care. They're always excited when they come into the office. And then working with moms to help educate them and how they can help their children grow to become healthy adults is just really rewarding. And I've been treated by chiropractors since the day I was born, so it's been a really positive experience in my life. So starting families off on the right foot and getting children growing into their healthy bodies is something I'm really passionate about.